Okay, I see you're back. This is a third part or trilogy, if you could say, about our healthcare crises pre-COVID. I've talked about the pharmaceutical people, I've talked about the insurance people. Today, we're going to talk about hospitals. Yes, we need hospitals. Yes, here in Billings, we have two great hospitals, but they're there to make money, folks. They really are. And in our seminars, what I like to show is an ad that was in our newspaper in August of 2018. It was an ad talking about what's going to happen at one of the baseball games here in town that weekend. And the ad said, courtesy of this hospital, we're going to drop 1,000 pounds of candy onto the field that the kids can gather up and take home and eat. And I would show that ad to people at my seminars. I say, what's wrong with this ad? And almost everybody got it. I remember we had one guy who said, Roy, they're not going to drop that candy from helicopters on the kids while they're out in the field. They're going to drop it on the field, then the kids can run out and get it. I said, that's not the problem. The problem is they're feeding all these kids lots and lots of sugar or candy. And I said, what this ad tells me is this hospital is saying, hey, we have some wonderful pediatricians here at our hospital who would love to put your kids on Ritalin for ADD, ADHD. So let us feed them this candy, and you call us next week when they're all hyper, and we'll put them on this Ritalin and settle them down. Now that ad worked so good in 2018, they ran the ad again in August 2019, and I got both those ads I show at our dinner seminars. So they don't have this problem in Europe. In this country, the US, 15% of our kids are on Ritalin for ADD, ADHD. In Europe, it's 0.5% of the people have trouble with ADD, ADHD. So our hospitals are not there to make friends with us. The other thing I like to point out about the hospitals is, have you ever seen one that doesn't have construction going on? And you haven't. How do they pay for that construction? They pay for it by people being sick. 10 years ago, most doctors worked for themselves. Now it's 90% of the doctors work for the hospitals because the hospitals are buying up these medical practices because they realize that it's a cash cow. These clinics have people coming back every month, every 6 months for the rest of their life to monitor the medications that they're on. They never get healthy. They never get off the medications. It's a reoccurring business. So they're making lots of money. And the other thing I like to point out about the hospitals is here in Billings with our Albertson stores, what else is in that grocery store besides food? And people say, well, a pharmacy. I say, well, what else besides a pharmacy? And most of them have a walk-in clinic. Now think about this, guys. You've had a head cold, a couple of weeks, you're coughing, blowing your nose, or you got some GI disturbance, you know, diarrhea, belly cramping. You go into that grocery store, you go in that clinic, you see the doc, and the doc says you need some medication. So you go back out in that grocery store and you get your over-the-counter medicines or you get your prescriptions. It doesn't matter. You say, you know, I don't feel too good. I sure don't want to do this tomorrow. So now, still blowing your nose, coughing, runny nose, sore throat, or diarrhea, cramping, you get your buggy and you go into the produce area and you start playing with the uh, uh, vegetables, with the lettuce, the tomatoes, the apples, the onions. You start doing your shopping while you're sick. And I want to ask you something. Is there anything better a clinic or hospital could do for generating new business rather than putting a clinic in a grocery store? It's a phenomenal way because you're making new clients, you're building up business every day by exposing people to these sick people. But from a public health standpoint, is there anything worse you could do than putting a clinic in a grocery store? And my answer is no. That's one of the worst health decisions or policies ever made. So what we've done here over the last series is we've talked about this perfect storm we have for our health care crises. Number one, we have the pharmaceutical industry trying to generate as much money as they can. Number two, we have the insurance people taking away our accountability, uh, taking away our desire to get healthy, and hospitals profiting on us at the same time. And this is all going on before COVID came up, before COVID-19. And it's still a crisis going on. We've now been diverted to thinking about this COVID thing. And we're going to talk about that. So thank you for listening today. Have a good day. See you later. Bye.